we're at a very critical moment now because the enthusiastic help at the time of the terrible earthquake and then the soon-to-follow cholera epidemic brought lots and lots of generous help. And what we did with that help, which was significant, like $13 million, we divided it into three, and we used a third of it for immediate help, helping people with surgeries because of their crushed injuries and the amputations that they needed, helping people get settled even in tents, doing distributions of food, water, clothes, but a third of it went to immediate help. And a third went into setting up new structures in temporary ways. For example, taking in orphans from the earthquake, taking in adults who were crushed because they couldn't be in the Children's Hospital, St. Damien's, so taking them into a different place, replacing programs that were destroyed in Port-au-Prince, even if they weren't ours, like the maternity and neonatology departments that were destroyed in Saint Francois de Sales Hospital in the city. So we started those programs. The School of Sister Joan Margaret for the blind and the deaf was destroyed, so we started in containers to help those children. So a third of our money went to set up very fast structural help to populations that needed a certain kind of help that was lost on them altogether. And then a third of the funds we put aside to build the long-term structures to carry the part that I just mentioned. In other words, buying permanent property, putting up walls, and starting to build the permanent structures that would house what we call the Angels of Light, the orphans from the earthquake, and the St. Luke Hospital for the adults in trouble and extremists, and the school St. Joan Margaret for the deaf and the blind. That's how we did it. In any case, we put our money to work, and to the great benefit of the people. And unfortunately, that coincided with two negative factors. One is a very universal falling of economy in Europe and in the United States, which puts giving in a precarious position, and also a lot of talk and doubt about what was done with money that came to Haiti, especially with big organizations and government-to-government pledges. And there's a lot of unanswered questions related to that kind of money, and that kind of dampens the enthusiasm of everybody to help Haiti. So we're in a precarious situation now. We'll barely make it through 2012, but 2013 is really going to be a game caller for us, whether we continue or not, especially with the new programs. So we can only encourage people who are in a position to be generous to please don't forget us here in NPH, wherever we're working. And by the same token, to encourage people who might have any doubt about whether their dollar gets there. For sure, when your dollar comes to NPH and is sent to us in Haiti or any of the other countries where we work, you can be sure your dollar gets there and goes to good work. So thank you very much for your generosity, for your past help, and for your friendship and care.